Welcome to the Agni Nursing Academy. Myself Gangaram. Yesterday only NORCET-10 individual AIIMS allocation result came. First of all, who all are selected in that particular exam, congratulations to all. And who all are not selected in that exam, no need to worry. So many exams are there in the upcoming days. The God is fixed a place for you and fixed a seat for you in the upcoming days exams. But in the NORCET-9, how you prepared? Like that only you have to restart your study, and you have to maintain a consistency for upcoming exams. Definitely you will reach your goal, and definitely you will get your dream job. That one is a nursing officer. Okay, you maintain a consistency for your exams. Now we'll start our today's session. The first question on your display, the question is, the most important parameter of Apgar score is option A heart rate, option B respiratory rate, option C grimace, and option D reflex. In the question asked, which one is the important parameter of Apgar score? We'll discuss about the Apgar score. Apgar score is given by Virginia Apgar in 1952. In the Apgar score will assess the physical condition of the child, and will do the two-time Apgar score, one at first minute, and second one at 5 minutes. But most reliable finding at 5 minutes. There is a most reliable finding in consider on 5 minutes. Okay. The maximum Apgar score is 10, and the minimum Apgar score is 7. Sorry, minimum Apgar score is 0, and normal score more than 7 is the normal score. In the Apgar score, there are five parameters are present. In the name Apgar, it is self only the given. First, we will discuss appearance. First name is appearance. In the appearance, we will see the skin color, and second one is the pulse. In the pulse, we will assess the heart rate of the child, and third one is the grimace. We'll assess the reflex responses. We'll give the stimuli to the child, and we'll assess for the reflex responses from the child in the grimace. And fourth one is the activity. In the activity, we will assess the muzzle tone of the child, and last one is the respiration. So many times question asked from here. That one is so many times question asked in the Apgar scoring. Which one will not find out? Like that question will be asked, and the always answer for that question is respiratory rate. In the question in the Apgar score is, we will not assess for the respiratory rate, we will assess for the respiratory efforts. We will see the respiratory efforts, not a respiratory rate. Okay, respiratory efforts. 5 parameters are there. One is appearance, second one is the pulse, grimace, activity, and respiration. Okay, we will see now Apgar scoring, and the most important parameter in the Apgar score is heart rate. Heart rate is most important parameter, because of the when we will start the resuscitation, we will give the resuscitation and positive pressure ventilation. It is based on the heart rate of the child only. That's why important parameter in Apgar score is heart rate. Now we will see the Apgar scoring, how we will give the Apgar score. There are 5 parameters are there. First one is the will assess for the skin color of the child. If the skin color child is fully bluish discoloration, then we will call as that one is a cyanosis. If the cyanosis is there, means we will give the score 0, and we will assess for the in the second thing we will assess for the we'll give the 1 score if the child is peripherally blue and centrally pink means that one is called as acrocyanosis. Then we'll give the score 1, and the second score will give if the child's full body is pink. We'll assess for skin color. If the child body is fully pink, then we will give the score 2. And second one is we will assess for the pulse. First we will assess for the pulse. If the pulse is not present, then we will give the score 0. If the pulse is less than 100, then we will give the score 1. If the pulse is more than 100, then we will give the score 2. And we will give the stimulation to the child, and we will assess for the reflex response of the child. If we are giving a stimulation child, but child is not responding anything to that particular stimuli, then we will consider that one is the absent response. When we are giving stimulation, then somewhat the child is responding that one, that is hypoactive means the minimal response is giving for the particular stimuli. That time we'll give the score 1. If the child is spontaneously responding or fully, that is prompt response to the particular stimulation, then we'll give the score 2. That one is the full response or spontaneous response, we can call spontaneous response. We'll give the score 2. And next one will assess for the activity of the child. In the activity, we will assess for the muscle tone of the child. If the child is not doing any movement, the full child's muscles are flaccid, then we will give the score 0, flaccid muscle. And if the child is giving response, some flexion of extremities, that time we will give the score 1. Some flexion of extremities, score will give 1, and the full flexion of extremities will give the score 2. Full flexion of extremities will give the score 2. And last, we'll assess for the respiratory efforts. If the child is not having any respiration, that one will called as apnea. In that child, will give the score 0. If the child is respiration is present, but it's a slow and irregular respiration, in that particular child will give the score 1. Slow and irregular respiration score 1 we will give. If the child is fully responding and the regular respiratory efforts are there, regular respiratory efforts, or child is fully crying, that one considered as a proper respiratory efforts, and will give the score 2 for that. I already told you maximum score is 10 and minimum score is 0. We'll see the now result. If the score is between 8 to 10, then we'll call it as a no distress. This one is a normal score, and we have to give in these childs, we have to do routine care for the child. Okay, in the upcoming session only, in another MCQ only, I will explain about the routine care. What will give, we will explain. Okay, if the score is in between 4 to 7, means we will consider that one is the moderate distress. In the moderate distress, what we will do means, first we have to assess for the airway. We have to clean the airway cleaning. And for the particular child, we'll give the stimulation for the respiration by the foot rubbing and all, back slapping. We'll give the stimulation, and we'll give the supine position for the child with the neck extended because of the airway maintaining. We'll give the supine position with slightly neck extended. And if the child need O2, means we will connect the O2 maintain. Okay, if the child is moderate distress, we will follow these things and we will give the oxygen in the last. And if the score is 0 to 3 means, if the Apgar score is 0 to 3 means it's a severe distress. Severe distress, we have to start immediate resuscitation. We have to start immediate resuscitation. Immediate resuscitation. Okay. In the upcoming sessions or MCQs, we'll discuss about the resuscitation also. Okay. Immediate resuscitation we have to start. This is about the Apgar scoring. Okay. Now we will see the answer for our question. I told you the important parameter in the Apgar score is heart. The every resuscitations follows depends on the only heart rate. The answer for our question is option A, that is the heart rate for our answer. Okay. Now we will see the next question. Which of the following scoring is done to assess the respiratory distress in neonates? Option A, CRIB score. Option B, Apgar score. Option C, Silverman-Anderson score. And option D is SNAP score. We'll see option one by one. CRIB means clinically risk index for babies. Clinical risk index for babies. In this, we'll assess the child, predict the mortality and morbidity of the child, especially in the preterms. Apgar score already we have discussed in the previous MCQ, and the last one is the SNAP, means score for neonatal acute physiology. Neonatal acute physiology. In this score, we'll assess the, especially who all are admitted in the NICU, we'll assess the severity of the risk and severity of the illness. We'll assess the by using a SNAP score, that one is a score for neonatal acute physiology. And we'll assess for the respiratory distress, we'll use the Silverman-Anderson score. We'll see here the Silverman-Anderson score. The Silverman-Anderson score will use for the assess respiratory distress syndrome. Will use for the assess the RDS, that one is the respiratory distress syndrome, especially in the preterms, and low birth weight babies. Low birth weight babies will use the Silverman-Anderson score for the assessing the RDS. In the Silverman-Anderson score, there are 5 parameters are there. The 4 parameters during the inspiration and the 1 parameter when expiratory. We'll see the which all of those. First one here it is there, upper respiratory chest movements. We'll assess for the upper respiratory chest movements and the lower respiratory, that is lower chest retractions, and third one is the gyphoid retractions, and the fourth one is the we'll assess for the, that is nasal flaring. We'll assess for nasal dilation, how much is there, and the last one we'll assess for the expiratory grunting. There are 3 grades are there, grade 0, grade 1 and grade 2. If the score is more than 7, that one is the severe distress. But in the Apgar score, more than 7 is the normal score. And the another one score will come, that one is the Downey score. This score is used for specially assess those who are on oxygen and mechanical ventilator. For that child will use to assess the respiratory distress in the, particularly those who are on oxygen and mechanical ventilator. In that particular child will use the Downey score for assess the RDS. Okay, don't confuse in these 2 scores. One is Silverman-Anderson score and second one is the Downey score. And especially this one used in the term baby. We will use in the term babies, and the Silverman-Anderson score we will use in the preterm babies. Okay. The correct answer for our question is option C, that one is the Silverman underscore score, and this question is asked in the previous NORCET exam. This is a important MCQ. Okay, in the last previous exams, this one is a asked question. Okay, now we will see the next question again. Which of the following not included in the essential newborn care? Option A, ear care. Option B, that one is the breastfeeding. Option C, clean the baby. And option D is temperature maintenance. Okay, we'll assess one by one, that is options. In the essential newborn care, what we will do first, we'll discuss step by step. We'll give the warmth. In this, we will clean the child with the pre-warmed towel, and we will maintain the temperature of the child. If needed means we will use the radiant warmer. Second one is the will maintain a hygiene for the child. Will maintain the hygiene for the child, because of there is a more prone to get infections because their immunity is low. And another one will assess for the, that is initiation of breastfeeding, initiation and exclusive breastfeeding, and in this we'll give the eye care. We'll clean the eyes from inner canthus to the outer canthus, and again umbilical cord care, and we'll give the vitamin K injection to prevent a bleeding, and we'll give the immunization. These are the steps which is I have told in front of you, that is the essential newborn care steps. Now we will see the one by one options which is not included. We will see. First we will see the from the last, temperature maintenance. Yes, we have to maintain a temperature. That is the first only I have told. Warmth, in that we will maintain the temperature of the child. This one also correct. Clean the baby. Yes, we have to clean the baby and we have to maintain the hygiene for the child. The option C is also correct, and the option B is breastfeeding. We'll start the exclusive, and there is an initiation of breastfeeding as soon as possible. We'll start. That one is option B is also correct. Our question is asked which one is not included in the essential newborn care. For that, option A is the correct answer for our question. That is the ear care. Ear care we will not do in the essential newborn care. Okay, option A is the correct answer for our question. Next we will see the another question. What is the diagnosis in the neonate with visible bowel loop at birth? Option A, gastroschisis. Option B, omphalocele. Option C, congenital diaphragmatic hernia, and option D is bladder extrophy. In the image shown, what is this? The image shown in this one is, what is this? Like that question asked. Okay, we will see gastroschisis means there is a protrusion of abdominal content externally, and it will not covered with any membrane. That one will called as a gastroschisis. And the option B is, that is omphalocele. Omphalocele means the protrusion of abdominal organs towards outside, but it's covered with membrane. It's covered with a particular membrane. That one is omphalocele. And the option C is congenital diaphragmatic hernia. In this case, what will happen means the abdominal content which will crosses the diaphragmatic cavity and it's enter into the thoracic cavity. That one will called as a congenital diaphragmatic hernia. In the particular congenital diaphragmatic hernia, we have to contraindicate for bag and mask ventilation. We have to remember, keep in mind, that is will contraindication for bag and mask ventilation. Bag and mask ventilation. Okay, this is contraindication in the case of the congenital diaphragmatic hernia. And the fourth one is the bladder extrophy. If bladder extrophy, that means the bladder is protruded out and it's exposing to the environment. In the which organs are protruded from the body, for that one is the first of all, the first nursing intervention is we have to cover and we have to prevent the injury. For that, if it is no any membrane is present, then we have to cover that one with a sterile dipped gauze. If the membrane is covered, means we have to important that one is the we have to that one prevent the injury for that particular sac. This one is the that priority intervention from the particular, that is abnormalities. Okay, I will, this one is the which image is there now. This one is the, see here, the abdominal content is protruded out, but there is no covering present. This one will called as a gastroschisis. Okay, here you see the abdominal content is protruded out, but it covered with particular sac. This one will called as an omphalocele. This one is will called as omphalocele. Okay, and this one is the protruded organs are present, covering not present. That's one gastroschisis. Gastroschisis. See here, and the bladder is extra and that protrude out. This one is the extrophy of bladder. Extrophy of bladder. And see here, the abdominal viscera herniated into the thoracic cavity. Here observe, that one is this one, congenital diaphragmatic hernia. The correct answer for our question is option A, that one is the gastroschisis. Option A is the correct answer for our question. Now we will go to the next question. A slapped cheek rash in characteristically seen in which of the following infections? Option A, measles. Option B, rubella. Option C, chickenpox. And option D is erythema infectiosum. Okay, we'll see one by one option. In the measles is caused by Paramyxoviridae family. Paramyxoviridae family. The genus for causing genus for that particular measles, that is mobilis virus, and the particular measles is, that is classical feature in the measles is Koplik spot. Koplik spots in that whitish bluish color appearance in the buccal cavity. In the buccal cavity, especially near to the first or second molar teeth. In the measles and the rubella, the appearance of rashes is the same. First will appear on the space, then it's go to the trunk, then lower part of the body. Okay, same it will follow. But in the measles and rubella, what is the difference means there is appearance and that disappearance of rashes, that their particular period will be different. On that particular, we can differentiate that one, which one is the measles and which one rubella. The rubella is caused by rubella virus, and it is also called as German measles. Okay, and that is third one is chickenpox. The chickenpox is caused by varicella zoster virus. Cause is varicella zoster. In the particular chickenpox, the appearance of vesicles, first it appears on trunk, followed by face, then scalp. The vesicles appear. Vesicles means the clear fluid filled, the particular clear fluid filled cavity, that one will be called as a vesicles. Clear fluid will be present in that like that a blister formation. In the vesicles, clear fluid will be present. Okay, and last we will discuss the erythema infectiosum. It is also called as fifth disease, and is also called as the slapped cheek syndrome. Slapped cheek syndrome. It is caused by parvovirus. Caused by parvovirus B19. B19. The here hallmark of the erythema infectiosum is slapped cheek appearance. Slapped cheek appearance. Here we will see here. Thus, these appearance we can see in the that one erythema infectiosum, or it is also called as that one is the fifth day disease. That is called as a fifth day disease. Okay, the incubation period of that particular that erythema infectiosum is 4 to 28 days. 4 to 28 days. After the 4 days, like this, rashes will be appears on the body after the 4 days. Okay. See here, the correct answer for our question is option D. That one is the fifth day disease or erythema infectiosum. Okay. Now we'll go to the next question. Here, the fetus starts secreting insulin by option A 8 weeks, option B 10 weeks, and option C 12 weeks, and option D is 16 week. In the question asked, the fetus starts secreting insulin in which week? Like that question is asked. We'll see one by one option. One by one. In the 18 week, what 8 week, what will happen means the child develops, that is the internal gonads, means the testes and ovaries will be developed in the 8 weeks of gestation. Testes and ovary develops. Particularly in 10 to 12 weeks, 10 to 12 weeks of gestation, the child will begins swallowing, and in the 12 weeks, the baby starts to urination, and start to secrete insulin at 12 weeks. Secrete insulin at 12 weeks. Insulin. In the 16th week, what will happen means in the 16th week of gestation, the bone marrow will be start formation. Bone marrow formation starts. Okay. In the 8 weeks, the internal gonads will develop, that means testes and ovary, and the 10 to 12 weeks, the child will start the fetus will start to swallowing begins, and in the 12 weeks, the child will start to secreting insulin and the urination, and the 16th week, bone marrow formation will be start. The correct answer for our question is option C. That one is the 12 weeks starts secreting insulin. Okay, we'll see now next question. The immediate after the birth, at 1 minute, the expected normal preductal oxygen saturation in healthy term newborn. Option A 40 to 50%, option B 60 to 65%, and option C is 80 to 85%, and option D is 95 to 100%. In the question asked, just observe, just immediately after the birth, at 1 minute, how much saturation is there? Like that question asked. In the preductal oxygen saturation, in the fetal circulation, there is a for the blood circulation, there is a connection present. That one is the ductus arteriosus. Before that one, before that one, how much oxygen saturation will be present in healthy newborn child, like that question asked. We will see preductal saturation. Preductal means before there is a ductus arteriosus which is present between the pulmonary artery and descending aorta. Before that one, which is blood flow to the upper limbs. Preductal saturation we will see in the right hand. We'll see in the right hand. Postductal in lower limbs. Postductal means when from the descending aorta, which blood flow to the lower part of the body, especially lower limbs. Will assess the saturation, postductal saturation in lower limbs. Lower limbs. Now we will see the saturation at 1 minute, how much it is there just after the birth. At 1 minute, the saturation just after the birth is 60 to 65%. 60 to 65%. In 2 minutes, that one is the 65 to 70%. 65 to 70%. And the 3 minute, that one is a 70 to 75 centimeter. 70 to 75%. And the fourth minute 75 to 80% is saturation. In the 5 minute 80 to 85% is, and in 10 minutes 85 to 95% is. These the oxygen saturation, preductal oxygen saturation just after the birth. At first minute it is a 60 to 65. In the second minute is the 65 to 70%. In third minute is 70 to 75%. And in the fourth minute is 75 to 80%. And the 5 minute is 85 to 85%. And in 10 minute is 85 to 95% is the oxygen saturation just after the birth. In our question asked the first minute, in the first minute how much here mentioned, that one is a 60 to 65%. Is the option B is the correct answer for our question. That one is the 60 to 65%. 80 to 85% is, it is in the 5 minutes. This one in 5 minutes, and 90 to, and that's 85 to 90 in 10 minutes oxygen saturation. Option B is the correct answer for our question. Next we will see the next question. Kangaroo mother care provide till, and this one last question, it is this na, this one asked in the NORCET-9 mains exam. This one question asked. Okay, now we will see that kangaroo mother care provided to the child till his weight gain. In the question asked, the KMC we will give na, that one if the child is, how much it will reach child weight, till the what age we will give, like that question asked. Especially the KMC will give in the, low birth weight childs, means the child's birth weight is who's less than 2.5 kg. Here option A is 1500 gram, option B is 2000 gram, and option C is 2500 gram, and option D is 3000 gram, like that given. Actually the KMC which one given in the LBW, we have to give the till the child grows normal. The KMC can give any family members, the mother, father, and their parents also. Any family member can give. The minimum KMC is 1 hour and the maximum is 24 hours. We can give the KMC till the normal birth weight is. The correct answer for our question, the question asked till what age means we have to give for now up to the normal weight development. That one is the option C is the correct answer for our question, that is 2500 gram. This one question asked in the NORCET-8 prelims. NORCET-8 prelims, this question asked. We'll feel that question is easy, but sometimes the easy questions will appears in the exam, definitely it will help us to increase our score. Okay, thank you so much. Like this only MCQs we'll see in the next sessions. Thank you so much.